And she served as the administrator for the Centers for Medicare and Medicaid Services during the Biden administration. Chiquita, thank you so much for being here. So many questions for you, starting with millions of middle-aged Americans caring for aging parents, as Maura just told us, while managing their own insurance needs. So what do families need to know about maximizing benefits and really avoiding dangerous gaps in their loved one's care?
You really hit the nail on the head. So many people are in the sandwich generation where they are taking care of aging parents, worrying about themselves, and potentially also still trying to help their children and make sure they get all the care that they need. One of the most important things, you talked a little bit about how important it is to shop well for your Medicare coverage. Medicare is both original or traditional Medicare, where certain services and benefits are covered, and Medicare Advantage, which can offer additional benefits, but sometimes be more restrictive. And so it is crucial during this period of time that people make sure that they enroll in Part D coverage so they can get their drugs covered, and really find out about caregiver services. There are additional services that are sometimes available. For example, during the Biden administration, we started a program for caregivers for people with dementia. And so really researching what options are available to you is incredibly important. I do also want to highlight that with Medicaid, it has been a lifeline for so many aging people who need home and community-based services. And a lot of states have programs that are available. Unfortunately, because of H.R. 1, states are going to make some tough choices. And so some of those benefits may be cut back. But these are things to really look for to make sure your state representatives and members of Congress know how important these benefits are to you and your family.
I want to expand on that. Well, let's talk Medicaid again here. The expansion still hasn't reached every state. So during open enrollment, how do you close the gap for people living in regions where coverage is limited or even non-existent?
Yes, it continues to be incredibly unfortunate. We have 10 states in the country where some of the lowest income among us are not covered. And so it's crucial that you go to your state website. You can always go to healthcare.gov and be directed to your state, depending on your situation, to find out what you are eligible for. Most people who are over the age of 65 are eligible for Medicare and Medicaid. And so it tends to be people who are younger who are not covered and missed in those eligibility gaps. But it is crucial to really find out what you are eligible for, and often working with a broker or SHIP counselors, which are nonprofit counselors that are there to help you and provide assistance without a financial benefit.
So let's talk about people transitioning from employer-sponsored insurance to the marketplace or even to Medicare. What's the most common mistake that people will make, and how do we avoid it?
Yeah, so transitions can be really challenging. And one of the biggest things is knowing when your coverage is going to end, and making sure you get coverage as soon as you can, so that you're not facing a gap. For enrollment in Medicare, really people don't always know this, but you go often to your Social Security Administration. So really finding out enrollment in the Medicare program can be incredibly seamless. And especially if you're coming from employer-sponsored insurance, your employer should help you with this process, because retiree coverage sometimes is built on a certain kind of Medicare coverage, like Medicare Advantage or Medigap policies. So talking to your employer well in advance of retiring is really important to know, so that you transition seamlessly. And then for people going from employer-sponsored coverage to marketplace coverage. You can look at healthcare.gov or your state-based website at any time as you're trying to figure out the transitions. I think one of the most important things to know is when your employer is giving you coverage, both you and the employer is getting a tax break. And so the coverage when you're going to healthcare.gov is subsidized as well by the federal government, depending on your income level. It's really crucial to look at two things, both what the premium is going to be, but also thinking about what your out-of-pocket costs are going to be. And I think that, one of the big things we're having now, Senator Kelly talked a little bit about it earlier in your program, is are really the enhanced subsidies and making sure that you are getting good coverage. So don't just look at the premiums, because you really want to know what it's going to cost for you when you actually use your care.
All right, Chiquita Brooks-LaSure, former administrator for the Centers for Medicare and Medicaid Services. Thank you for that information, really important for all of us, and thanks for being here.
Thank you.